Good morning. Welcome to this session regarding home health data reporting and submission. As Mark said, I'm Jen Pettis from APT, and thank you all for joining us here today and for joining me in this session. Before we begin, I'd like to get to know a little bit about your role in data submission and reporting. So if I could, by a show of hands, I'd like to ask a few questions and learn a little bit about what you do in this process. Who in the room actually submits OASIS files, so actually uploads them to the system? Okay. Who pulls the reports that are made available to providers? So who goes into that system, pulls down reports, and perhaps uses them or distributes them to your colleagues or perhaps both? So a few of you. Who uses the report? So I'd like a show of hands, but I'd also like to ask you to give me some ideas who within your agency uses these reports. So is it directors of nursing or agency directors? Who uses them? If you could shout them out, I'll repeat your answers for you. Quality coordinators. They use them to provide feedback to clinicians. Okay, other thoughts about them? Right, okay. And so I asked, kind of asked this question already as to who you share them with, and if you are the one who pulls down reports, who do you share them with? So I heard feedback to clinicians. Do you share the reports or the information in your reports with any of your referral sources? So do you share them with upstream referral sources who refer to your agency that are saying, hey, what are your quality outcomes? Why should we send our patients to your agency? And then perhaps with other partners as well. So lots of information in these reports. We're going to spend some time looking at particular reports, talking about errors in reports, and hopefully you'll leave this session with some ideas about how you might be able to more effectively use these. And hopefully you'll leave with a few things on your action plan. I do want to just take a moment and remind you that there's a great action plan in your packets for you. So particularly when we get to talking about errors in your reports, you may have the opportunity to pull out this action plan and make yourself some notes for your to-do list when you return to your agencies. So let's get started by reviewing the objectives for this session, and they're on this slide and the next. And it's my hope that at the end of this session, you'll have identified some strategies for successful OASIS data submission, and that you'll describe the process to navigate the certification and survey provider enhanced reports or CASPER application, that you'll be able to discuss the purpose, location, and common errors associated with final validation reports, and that you'll be able to identify those top 10 errors that are associated with OASIS submission, and more importantly, that you'll know what to do about the errors when you receive them back. You'll be able to discuss various CASPER reports and other reports that are made available to home health providers, and you'll be able to locate resources that can support you in data submission and reporting. So let's get started. Like the presentations that you've already seen this morning, there's a few slides of acronyms. I won't review these with you, but I do want to point out that there's that large list of acronyms that's really nicely formatted and available in your packet there. So by all means, feel free to have that out on your table and use that when you return to your agencies. So I'd like to begin to share some tips to remember before you actually submit your OASIS records to the Assessment Submission and Processing, or ASAP system. First, ensure that you have a CMS Net user ID and password, and that the Juniper communication software is correctly installed on your computer. These allow you to connect to CMS's private network to access the Quality Improvement and Evaluation System, or QIES ASAP system, and the CASPER reporting application. Ensure that you've registered for and activated your QIES user ID, and this allows you, again, access into those systems, both the QIES ASAP system and the CASPER reporting application. Each provider is allowed 2 CMS Net and 2 QIES user IDs. So Kathy mentioned earlier about the importance of that backup person. This is going to be an opportunity for the primary person who goes in and submits OASIS and pulls down these reports to have a user ID, and then that backup person as well. Information about how to obtain these user IDs and certainly about how to change them if you need to do so is available on the QTSO website, which is www.qtso.com. The QTSO website you'll see mentioned over and over as I go through this program. There's lots of manuals. When you think about the OASIS manual that tells you how to actually do the OASIS, there's a separate set of manuals that tell you about the process of using the data that come from that OASIS, and they are available on QTSO, so do check out that website. Your organization needs to use data entry software that's capable of formatting your OASIS records into XML format and exporting those files that in accordance with CMS's standard record layout specifications, so the data specifications for the OASIS. And you can find those on the link that's noted there on your slide, and all of the data specifications for each and every item on that OASIS are available there. Finally, before you submit your records, ensure that your facility ID you entered when you registered for your QIES user ID is correctly entered into the OASIS data entry software that you're using. If any of the steps on this slide and the previous slide haven't been successfully accomplished, don't attempt to submit those records. OASIS records are submitted into the QIES ASAP system via the OASIS submission system, and you'll see a link to this on the Welcome to the CMS QIES System for Providers webpage. In addition, you'll see several other links, including the link to the QIES user maintenance application. And this is the application that you would access if you did need to reset passwords or perform other account maintenance. So you'll see that right on that welcome page as well. When you access the OASIS submission system, you'll log in using your QIES user ID and password, and then you'll upload your files containing your OASIS records at that time. So after you upload your records, what happens next? You'll see an online initial confirmation message. And in that initial confirmation message, there's important information about the submission, including a submission ID. That submission ID is a unique identifier that's assigned to the file when it's received by the ASAP system. Be sure to print this out. You want to print out that document. It's going to be helpful to you when you're trying to locate your agency final validation reports in this system. In addition to being available on the QTSO website, the OASIS Submission User's Guide is available via a link on the Welcome to the CMS QIES System for Provider webpage. And in the guide, you'll find the detailed information to guide your submission of the OASIS data. And there's a screenshot of the welcome page for you. There's several features and functions that you can access from this welcome page. The OASIS user registration is that top link, and that's the self-service provider user registration tool where you can register for a user account to access the OASIS system and the CASPER reporting systems. The OASIS submissions link appears right in the center by the key. And this brings you to the login page of the system through which you can submit your records as well as corrections to those assessments if need be. The CASPER reporting link brings you to the login page for the CASPER reporting application through which you can request and view many of the reports that we're going to talk about today. Next, you'll see that QIES user maintenance application that I mentioned to you just a moment ago, and there's a user's guide to the maintenance application right there. And finally, there's a link to the OASIS forms. So lots of different paths that you can take from this Welcome to the QIES System for Providers homepage. So if you've submitted those OASIS files, then there's that question to say, well, I've submitted them, now what? What happens from here? And I think it's important to remember that submitted doesn't mean accepted, right? So the next thing when you're submitting those OASIS files, you're going to want to take a look and say, were these actually accepted? And if they were accepted, were there any issues with those records that you need to take action on? And the way you can find out that information is through your final validation reports. So those and other reports are available to you through the CASPER reporting application. And as I mentioned to you on the last slide, there is a link that takes you to the CASPER reporting application from that welcome page. So you'll log into the CASPER system using your QIES user ID and password. And then you're able to obtain your final validation reports. And the final validation reports are system-generated reports. They're generally available within 24 hours. They're available within 24 hours, generally much sooner than 24 hours. The final validation report provides feedback about each record in the submission. And a final validation report will be created for the submission if the provider and the record can be identified in the system. If there was no final validation report, it indicates that there was a serious problem with the file or the records, and the records could not be extracted from it. And we'll look at this type of error a bit more closely in just a bit. When your final validation reports become available, they're going to be automatically placed in the Shared Provider VR folder. And this is a read-only folder that's available to you, and that's where these reports are stored. This is one of 3 permanent folders that's available to you, and it can be accessed by anyone who's able to submit records at your agency. So the Shared Provider VR folder is permanent, and again, you can access it if you're able to submit, and anyone else who's authorized to submit can access it as well. There's 2 other permanent folders that are available, and the first is My Inbox, and this is where user-requested reports are stored. And then there's the Shared Provider folder, and this is where the agency-level automatically generated folders are stored. Shared folders can't be changed or customized in the system. However, there are options to customize the CASPER reporting tool, and you can find more information about that in the CASPER Reporting Users Manual, specifically in Chapter 2 of the CASPER Reporting Users Manual. Again, you can access that manual via the QTSO website. Some of the customization you could do, you could add additional folders if you wanted to, where you could store reports and things, and again, access that user's manual to find out more. So there are 2 types of validation reports that are available to home health agencies in the CASPER reporting application. The one we're going to focus most of our energy on today is the system-generated final validation report that I just mentioned. The other is called the submitter final validation report, and it is not automatically generated, but it can be requested to help you identify if there are severe errors. So if you are not getting a system-generated final validation report back on a submission that you think you sent in, then requesting this submitter final validation report is going to help you do some research on that. So how do you find the final validation reports? First, you'll select the VR folder, and then a list of the system-generated reports will display in the right, the right frame. Remember, at the very beginning of the program, I told you about a submission ID that you'll want to make sure you make a note of or print out. You'll use that submission ID from that initial confirmation message to then locate your final validation report in the VR folder. So how will you find it? How they're labeled are noted here on this slide. The final validation reports are labeled with the submission date and time, then a dot in the submission ID. The example that's on the slide for a final validation report name is 07/01/2016, 15/30/29, then the dot 789541. So what do all those numbers mean? The 07/01/2016 means the submission date was July 1st, 2016. The 15/30/29 indicates the submission time. And the time of that submission was 3:30 and 29 seconds in the afternoon. And then those last 6 digits, the 789541, those represent the submission ID. So each report name that appears there in your folder is going to be a link through which you can open and view the contents of that report. There are a couple of formats for the reports. The first is a text format. In this format, this report can be identified by a little notebook. It looks like a little notebook icon that's right next to the final validation report file name, or the link to the name. And this is definitely the most user-friendly report. So if I'm the clinician, I'm a nurse, this would be the report that I would go to. And this is the report version that we're going to take a look at momentarily. The other version is the XML formatted report, and this report is intended for use by software vendors, and there is an XML icon that's beside that indicates that version of the report. Y'all doing okay? Great. This is heavy-duty stuff. I'm grateful to be before lunch and not at the last session of the day. So I appreciate you sticking with me, and hopefully you'll be making some additions to your to-do list when we get through some of this information. So this screenshot is of the CASPER folders page, and the folders available to you are listed on the left. It will be your left there. And then in the center of the page, you'll notice the links to the reports. And there you'll see the XML version with it's kind of a little white page with a red banner that says XML across it. And then the text formatted version is the one with the little green notebook that's alongside of it. And this slide shows an example of a final validation report, and we'll talk about kind of the parts of this report. The header, or the upper portion of this, includes information such as the number of records processed, accepted, and rejected. And it also includes information about the submission, the agency, the file name, the ID, all of that included there. In the body, or the lower portion of the report, information about each individual record is included in that submission is provided. Included in this section are any error messages that you might receive. And let's talk about error messages a bit. I will share with you that when I learned all about these different kind of errors that come back, I'm not a computer wizard. I'll share that with you. So for me, I kind of struggled to say what exactly do all these different things mean. So I'll share the analogy that I use for this with you. When you think about files and records, think about if you have one of those giant manila interdepartmental mail envelopes that has tons of stuff that's heading to Department X in the facility, in your agency. So think about the file as that big giant manila envelope on the outside that says all of these pieces inside are heading to that other department. So once that makes it there, that's kind of my analogy for these fatal file errors. If that big old manila envelope didn't make it at all to the other department, that's when you're going to get this file error. So not only that means that it's not possible if the file didn't make it, if the envelope didn't make it, it's not possible that anything inside of it made it. Does that make sense? Okay. So file folders, file errors, fatal file errors, means that there was something incredibly wrong with that entire envelope, with that entire big file. This could be things like it's not a zip file, or the zip file, it is a zip file, but the system can't pull the records, individual records, so you can't open that manila envelope and pull the stuff out. It can't be, it's not useful when it gets there. Or the file simply can't be read. So again, this is how, the way you'll know about these are you'll use that submitter final validation report, and that will list fatal file errors. So if you are not getting back a final validation report, that's when you're going in and requesting a submitter final validation report to actually tell you about these fatal file errors. Okay? In this case, you'll have to figure out what happened and then resubmit the whole file again. So if the whole file goes through, so now that big envelope has made it to the other department, now they begin to look at all of the stuff inside that big manila envelope or inside that file of OASIS records. So again, it's looking outside structure, file's okay, it made it through, now let's look at the individual records that are there. So individual records within an accepted file can also be rejected, and those will be your fatal record errors. These errors include things like out of range responses. For example, the options for you to choose when you're coding that assessment or filling in that assessment are 1, 2, and 3, and somehow a 6 made it through. That system is going to kick that back to you and say that doesn't conform to the data specifications, take it back. There may be things like inconsistent relationships between items. So if your patient birth date in M0066 comes after M0102, the physician's start of care, clearly you can't be born after the care starts, right? So that's going to kick that record back to you as well. So fatal errors result in that individual OASIS record being kicked back, saying this has not been accepted, you need to fix something here. Again, the whole file went through, so something in that file was accepted, but these individual records were not. And then there's also warnings or non-fatal errors, and these are certainly the preponderance of issues. When we look at the actual errors in a bit, you'll see that these are the high flyers. So this means that the whole file made it through, so all of the entire large file made it, all of the records so in order to have a warning message or a non-fatal error, the file itself and the record itself has to be accepted. So this OASIS record was accepted, but this is a flag back to you to say something's not quite right here. Some of these error messages you're just going to be looking at and saying, well, that's not exactly the way we wanted it to be, but there's nothing I can do about it except take a look at how I can prevent it the next time. And some of them will actually be errors that you need to go back and correct. So think about the process of you're receiving that final validation report and you're going through and saying, okay, everything was accepted. And now the next step is to take a look at what are these non-fatal errors or the warning messages and really dig through them and say, why am I getting these back? An isolated error message might be very different from the one that you see on every single validation report, right? That may be a system problem. And we'll talk about some of these kind of isolated versus system problems as we move along through this. So with these warning messages, you can think of them as missing or questionable information, but it's not of a critical nature. So the record is still accepted into the system. Some examples here are timing errors, and you'll see in a bit that this is the most common error, and that is that the OASIS is submitted greater than 30 days after the completion date in M0090. And again, you'll get a warning with that. It will still be accepted, it will still be in the system, but you're not in compliance with the requirement for timing. And that's the example that I say, if it happens once in a blue moon, maybe someone who usually submits, maybe both people were out for some reason. Maybe both of you are here with us today. But if it happens over and over again, this is a system issue, and it's going back to the drawing board to take a look at your processes around submission. Record sequencing errors, these are when a record or an OASIS record hits the system and something that should have been there before it perhaps isn't there, is a good way to describe this. So this would be the start of care assessment is received after the resumption of care assessment. Okay, they're still going to be accepted, it's just not the way the system expects to receive them. So all of these error messages or non-fatal, warning messages or non-fatal errors are going to be returned to you on that final validation report. And again, it's the provider's job to then go through and look at each and every one of these errors and say, what do I need to do about this? Do I need to take action or don't I? Do I need to deal with this individual record, or do I need to change my whole system because it's just not getting the results that I need? So we'll look at the top 10 error messages in just a bit. Please note that your final validation reports are automatically deleted from your folder after 60 days. You can still request that OASIS submitter final validation report using the submission ID at any time. Also keep in mind that fatal errors, so when that individual OASIS record isn't accepted, that you need to deal with that to fix it, to fix the issue, and resubmit it such that you're able to comply with that 30-day time frame. And I can't stress enough the phrase that I always say is, submitted doesn't mean accepted. The only way you know if they're accepted is to look at that final validation report and say, was there a fatal record error that I need to address to get it back in there? Okay, so you're still required to do that within 30 days. With setting up systems, when I would be dealing with this with organizations, my recommendation would be don't be submitting on day 29 or 30, right? Because then it's too late. If you get your validation report back on day 31, what are you? Non-compliant if you need to go in and fix that. So when we look at the number of late submissions in a little bit, hopefully it'll resonate with you to say, let me look at exactly what we are doing here. 5 or 6 of you in the room said you're doing the submitting and getting the reports. So that means the other 100 and some of you, someone else is doing it on your behalf, right? So I would be checking out to say, what exactly is happening? Let's look at some of those validation reports and really see together what's happening from a quality of, process quality standpoint. Okay, ready for a polling question? This is a one with lots of numbers. So let's take a look at a final validation report name. The name of our report, 01/25/2016, 15/29/31. Then there's a dot. And then our submission ID part of that is 956214. So what date is this report referencing? So go ahead and use your clickers. Hopefully, it looks like lots of you are responding. This is my eye exam for today to see if I can see how many are responding. It looks like y'all are busy, so thank you for that. All right. And you guys did great. That is January 25th is the date of that. And again, that's 01/25/2016. So the first 8 digits in your final validation report are the date. The next 6 are the time down to the second. And then the submission ID is the final 6 digits. Okay, here's the moment you've all been waiting for. Oh no, not that check. This is the moment you've all been waiting for. What are the final the top 10 errors, messages that come back for your OASIS records. I want to point out to you that these numbers represent the number of error messages for the first 3 quarters of 2016, so for calendar year 2016. So essentially, when you look at the number of errors here, we've got almost 2 million for this one. So you could add another third on that to really understand the amount of these that come back in a year. So there are an awful lot of these errors that come back. So the number one error that we have is error 3330, record submitted late. So this is a warning message, and the cause of this is just what you would assume it to be. Whoever submitted that assessment didn't do it on time. So if I'm the person who's looking at the QA, looking at the system as a whole, and I see this error on validation report after validation report after validation report, I know that there's a problem with my system, right? Again, if this happens once in a blue moon and there's some crazy circumstance to lead to it, that life happens, right? But when this is constant over and over and over, it's a time to go back to the drawing board and say, what are we really doing here? And maybe a little root cause of this would even lead you to say, most of them are submitted okay, but it's those ones that we have a error with, that fatal error that we don't actually go back and address in a timely fashion. Those are really why we're late with these submissions. So it's really going back and taking a look to say exactly what's going on. And your final validation reports can help you with that discovery. Again, I want to stress the number of this. It's nearly 2 million for 9 months, and I'm sure you're all saying, but that's not at my agency, right? It must be those other guys who aren't here today, hopefully. So what do you do if you get this? Again, you double check, you look at the assessment and make sure that it's accurate. And if it is accurate, it's time to, and it's happened more than on an isolated basis, it's time to take a look at your system at large for that. The next most common error is 915, and this is patient information mismatch. This may be one of those error messages that you really just need to go back and validate that you're right and just continue on, because there are legitimate reasons that this error is going to happen. It's caused by patient information being similar to but not identical to information from another record in the system. More specifically, one or more of the fields that are used for patient matching don't quite jive. All right, and I'll give you some examples. Maybe the patient's first name was spelled, my name is Jennifer, maybe they spelled it with one N the first time and you corrected it the next time and spelled it with 2 N's. So you did the right thing, you corrected the information about that patient, and you're just going to continue on, right? You're going to validate it. Yep, I know I fixed that. Nothing I need to do, move on. It may be things like a Medicare or Medicaid number that wasn't known previously becomes known to you, so it was blank and now it's filled in. Again, fine with that. So what you're going to do with this error is take that validation report, go to the field that they're telling you has changed. You're going to take a look and say, is it right or not right? If it's right, done, move on. If it's not right, you may need to correct that assessment, okay? The number 3 error is 907. And this is a duplicate assessment. And this is a fatal error. Now, my guess is that you guys all have too much to do in a day. Is that a fair statement? So you don't need to be submitting things twice, right? That is all this is someone submitted a record once and they tried to do it again. So here's a system that's leading to inefficiency in your processes, right? This is your staff has taken time to do something they've already done. So if you're getting this error back, this is an opportunity to go back to the team and say, what is going on, guys? We want to be submitting them once. We don't want to be doing it twice. Let's look at our system here. Again, this happened almost 500,000 times, so 400,000 times in that first 9 months. So that's 400,000 times that a staff member did something they didn't need to do and could have spent better, is kind of how I look at that. Again, it's a fatal error. It's going to kick it back and say, you already sent us that. Don't send it again. And you're going to hopefully try to figure out why. Don't try to resubmit the record. If you were intending to submit a correction to a previous record, again, that's going to go back and correct that or modify that record the correct way. But you're not going to be just resubmitting a previously accepted record. The fourth most common error is 909. And this is a warning message indicating that the submitted record does not satisfy sequencing guidelines that have been established by CMS compared to the record that was submitted to the system prior to this one for the patient. So this is the example of the resumption of care went in and then the start of care. And again, it's a workflow issue. There's a very limited number of exceptions to these requirements for timing. And if you're certain that what you did was correct, that you don't, no action is going to be necessary. But if you might look at this and say, well, the resumption of care is in there, but there's actually no start of care. So what are you going to do then? Submit your start of care, right? It's going to be late, but you're going to want to get that record into the system. So with this, you're going to want to be reviewing the activity, the records, the reports, to really figure out what happened, what led to each individual scenario. And after reviewing them, if you say, I shouldn't have created this record in the first place, that was my error there, that you're not able to go in and fix yourself. That's when you need to get some help. And that help is your state OASIS automation coordinator. And again, the OASIS guidance manual has information about that. So if you realize that a record is in there that should have never been in there altogether, that's when that automation coordinator is going to be the person to help you fix that. And the number 5 error. This one could be a little confusing, and I'll try to talk you through this one. This is a warning message. What it means is invalid HIPS code. It's a warning message that might mean there's a problem, or it might mean everything's just fine. And it may be a software error, but it may not be a problem at all. This has come back about 200,000 times in those 9 months. You may need to report this error to your software vendor, you may not. So let's talk about that. You only need to report this issue to your vendor if the error occurs and therapy is anything other than not applicable. Okay, so if you get this error and therapy is NA, you don't need to do anything, right? But if you get this and therapy was anything other than NA, that's when that's a problem. You need to be in touch with your vendor. And are any of you thinking, how could we possibly remember all of these numbers and what they mean and what we're supposed to do about them? Or are you just thinking, what is she talking about, right? The good news is there is a manual to help you with this. Again, on the QIES website, it'll walk you through each and every error message that you can figure out exactly. It says, what's the error number? What is the name of the error? What does it mean? And what do I need to do about it? So use that manual to guide your work with these final validation reports. And the number 6 error also deals with timing. And this doesn't have to do with submission. This actually has to do with assessment completion timing. And it is a warning message, and it indicates that the submitted record doesn't satisfy CMS's timing guidelines for follow-up assessments. More specifically, the follow-up assessments need to be completed at least every 60 days, and it needs to be completed on or after the 56th day and on or before the 60th day of that cycle. Again, here there's a limited number of exceptions. If you're correct due to that exception, no action is necessary. The OASIS Guidance Manual will give you more information about the timing. And again, this is a potential indicator of need to look at your system, or how are those assessments being completed that's leading to the timing issues. The seventh most common error is 3320, and that's inconsistent dates. And this, again, is related to the assessment not being completed according to CMS's timing guidelines. More specifically, the reason for assessment was noted as 9, or discharge from the agency, but M0090, date assessment completed minus that discharge, transfer, or death date, was not 2 or less days, basically. No action is required. If you need to make a correction, you would do so and resubmit that record. And to avoid it in the future, make sure that those are timely and verify that your system is intact to meet those needs. The number 8 error, is 3160, and this is invalid HHA agency ID. And that is just what it sounds like, that the agency ID that's been submitted in the file doesn't identify a valid provider in the QIES ASAP system. This could be a user or a software issue error. It could be the person who's entering also could relate back to your software. If it's a user error, you would just correct this error and resubmit the record. If it is a software issue, then your vendor will be able to help you with that. And the number 9 error is 903, and this is a required item is missing or invalid, and this is a fatal error. So your whole file will have been accepted, but this is going to mean the record itself is coming back to you. It was not accepted by the system. You may receive this error if a value submitted exceeds a maximum length, or if for some other reason a value isn't an allowable value according to the specifications that are put out by CMS. So if you failed to include the value, that is, didn't fill something out correctly, you would just correct it and resubmit the record. However, if your software allowed you to do that, then it's probably an issue you need to be in touch with your vendor as well. And the number 10 error. This is also invalid value. Again, this error is similar to the prior one I mentioned. It's also a fatal error. And again, this is one. The other was you're putting in a value. This is where you have options to select, and you selected something that isn't actually an option. Okay, so pick 1, 2, or 3. You picked 4. The other one is blank box, put a number in, and you put a number in that didn't quite work. Okay, so they're essentially the same. They're just with a little different type of assessment item. Again, this is a software issue. You're going to want to contact that vendor. Okay, and another polling question for you, so get those clickers ready. What is the number 1 error message for OASIS Records? Is it 4820, invalid HIPS? Is it 907, duplicate assessment? Is it 3320, inconsistent dates? Or is it 3330, records submitted late? Take just a couple more seconds there. And you guys did great. 100% of you said it's submitted late by all those other guys, right? Not you. Phew. All right. Let's switch gears, guys, and talk about some quality reports. We've got a ton of reports that we're going to talk about here. We've got some screenshots of them. If you're not familiar with the reports, I challenge you here to kind of think about what it is you do at your agency. And as we go through these reports, kind of envision How could you use these? What would you, if you're provided with these reports, if you could go to that person who prints the reports and say, I could really use this particular report for quality improvement, or I really want to understand some characteristics about my particular patients and why staffing changes or some characteristic of the type of care that you provide is changing. These reports can help you dig into that. We're going to talk about trend reports. Those are my favorite to use in quality improvement, because you can really, it tells you about an evolving problem. It doesn't just give you this report of, yikes, you've got a problem, but you can begin to look at things are getting a little worse or things are getting a little better. These are full of rich information, and with the reports, oftentimes one report is going to be useful to you to investigate another report. So to really be able to dig into the details here, it's really important to be able to understand a bit about all of them. Just like with those error messages that I mentioned to you a bit ago, there are manuals that explain all of these reports to you. It's on the QTSO website. You can look through that manual to really, if you're wondering, which one of these reports can help me with whatever, you can find that the details of the reports on that and samples of the reports and really get some insights into how they might help you in your operations. So this graphic provides a representation of the reports and how they support public reporting and compliance. So if you look at the pink shaded area, there's confidential reporting that happens for the providers. So that's your quality measure reports, your review and correct reports. The provider preview reports and the compare website, that supports your public reporting. And then the compliance, you've got your final validation reports and your provider threshold reports that have been renamed. Those are renamed your quality assessment only or QAO reports. So you've got all of these reports that are really designed to support different things. If I was making this graphic or kind of creating this in my way of thinking, I'd put a big giant circle around the whole graphic and say quality improvement, because all of these can help you in quality improvement. So although they're made to support specific things, there's lots of uses for these. So we are going to examine the reports listed here individually, and let's take a look. We're going to review a few categories, for lack of a better word, of CASPER reports. The on-demand reports, these include the quality measure reports or QM reports and the review and correct reports. We'll also look at provider preview reports, and these are distributed reports. So these appear in your folder. You don't have to go looking for these. Well, you have to go looking, but you don't have to ask for them. Again, I have mentioned that there's resources to help you. The CASPER Reporting User's Manual. Use it, love it. It will help you tremendously to understand these reports and to effectively use them. It is available on that Welcome to CMS QIES Systems for Providers webpage. It also is available for download on the QTSO website, and you'll see there's the title, OASIS Users Guides and Training. So when you click on information for OASIS, up at the top of the QTSO website, there's going to be a couple of other kind of choices for you, and one of those is going to say Users Guides and Training. So you'll click on that and be able to find these resources. And two public reporting platforms are noted here, and I want to just quickly mention those. The first is Home Health Compare. Home Health Compare is available at Medicare.gov. I'm sure that most of you are familiar. How many of you have been to your agency's Home Health Compare website? How many of you have been to your friends or neighbors? Yeah, checking them out too, right? That's what it's all about. You may be less familiar with the second resource that's listed here, and that is data.medicare.gov. And here's where you can actually find the data sets that are used on Home Health Compare. These data are downloadable in various formats and available publicly for folks to use. We are also going to review the Quality of Patient Care Star Ratings Provider Preview Report and the Quality Assessment Only, or QAO, Pay for Reporting reports, including the interim report that can be used to track your status from quarter to quarter, and the annual report that aligns with your annual performance update, or APU. Let's start with the QM reports, the quality measure QM reports. These may be referred to as CASPER user-requested reports, and they meet the requirement for confidential feedback under the Impact Act. The QM reports are available at both the patient and the agency level, and they're available for a single reporting period. When you're running these reports, they're going to default to the most recent data available, but you do, as a provider, you're able to select the data collection period that you'd like to run. So it's going to default to a quarter, the most recent quarter that's available, but if you wanted to look back at an additional quarter or lengthen that time, you're able to do that. So you're able to really specify what you want to see there. They are available on a monthly basis, and they're very useful to identify potential data submission errors that may impact the quality of your agency's QM data, and these also are incredibly useful in your quality improvement activities. These, to me, are very, very rich reports. We are going to review all of the reports that are listed on this slide and the next, and I'll just run through these really quickly, and then we'll dig into them a bit more in a moment. The risk-adjusted outcome report, both the 2 and 3-bar versions. There's a potentially avoidable event report, and we'll look at the potentially avoidable patient list and the 2 and 3-bar versions of this report. We'll look at the all-patient process quality measure report, and again, the 2 or 3-bar versions of that. The agency patient-related characteristic reports, the 2 or 3-bar versions. And you might be saying, what is the 2 and 3-bar version? What does that exactly mean? Well, the 2-bar version shows your current results plus a national reference, and then the 3-bar version includes those 2 bits of information as well as the information for a prior period of time. And I'll point out exactly where those all kind of fit as we begin to look through the reports. We do have an example of a home health agency trend analysis report. I mentioned that report to you earlier, and of the characteristic analysis reports. We'll also look at the outcome tally report, the home health process measures tally report, and the patient-related characteristics analysis summary report. Okay, and there's a quiz on all those. Did you get them? No. Lots of reports, huh? It's kind of overwhelming, like, what do I do with all these? But again, each one has its purpose. That manual will really walk you through what can you do with all these different reports. So let's take a look at the first one, and that is the patient-related characteristics 2-bar report. This report compares in a 2-bar chart the home health agency's mean values for approximately 250 patient-level characteristic items to those in a national reference sample for a specific period of time. Some categories of the characteristics include things like patient history, general health status, care management, integumentary status, and activities of daily living. Again, there's lots of others. Those are just a few of the categories. Note the number of cases in the sample is also noted, as is the number of cases in the reference sample and the time periods. And that information, I think we have a pointer. It's like right up in there on the report. You will see actually right there are the dates and there are the cases. So in this agency, it is 151 cases, and then in the national sample, there's over 6 million. So you can see, again, your agency's number of cases and how you're comparing, how many you're compared against. And then the next, this report is also available in a 3-bar format, and this includes the information that I just mentioned, as well as included in the prior period for the agency. There's not a prior period of data for the sample, the national sample. Again, think about with that many million records. Is it going to change that much from quarter to quarter? Probably not, right? But your agency with that 150 some, or in this case 170 some, might change. The Agency Patient-Related Characteristics Analysis Summary Report summarizes by outcome the average percentage achieved or not achieved and the difference for about 40 case mix categories. For this report, patients that are considered to have achieved the outcome or triggered the outcome are the number of patients. Again, they've triggered that measure, so they're included in that when you look at achieved. They're the residents that triggered it. Next, we come to the risk-adjusted outcome 2-bar report. Kathy talked a bit about risk adjustments earlier this morning. This report provides end result outcome measures, utilization outcome measures, and claims-based outcomes measures separately. A page break is going to occur between each of these 3 types of measures, and requested and actual time periods associated with each of the measure types, as well as the current and reference sample sizes, will be reported on the pages with the separately reported types of measures. The sample that's shown on the slide here is a portion of the end result outcome measures. Note that the significance levels are provided for each measure when the sample size is at least 10. Now, footnotes are going to be provided for the person who's using this report to help the user understand what the values actually mean in light of their data. So you want to be able to determine, are the results are they really a factor of interest to you? Or are they simply more likely due to chance based on the number in the sample? So that's going to give you some important insight to say, are you worried about this, or is it more likely not an issue because the sample size of the sample size? So again, look to that significance level. Bar graphs, I think, give you a great visual of really how you stack up to that national reference. So how do you compare to others? Next is the risk-adjusted outcome 3-bar report. And this report is very similar to the 2-bar report we just looked at, except it also compares the end result outcome measures, utilization outcome measures, and claims-based measures to the national reference standard, as well as your prior period for your agency. So 2 agency level bits of data here, prior period and current period, and then the national reference for the current period as well. And again, it's important here to refer to that CASPER Reporting Provider User's Guide for specifics about which episodes are used in calculating the different measures. I mentioned utilization outcomes, end result outcomes, and claims-based outcomes measures, and they are going to be computed differently. So your end result outcomes are computed for episodes of care ending with a discharge to community, whereas your utilization outcomes are computed for episodes ending with a transfer to an inpatient facility or discharge to the community, and the claims-based measures are calculated based upon the episode begin date. So it's different pieces of data. So to me, this is an important point of understanding kind of the details, what sits below the measures, so you really can understand what the results actually mean to your agency. So use that that user's guide to help you with that. There are about 40 measures that are reported on this report, so tons and tons of information available to you here. Next, let's look at the potentially avoidable event patient listing report. This lists each of the 12 potentially avoidable event measures, statistics for each, and the patients who experience those events for a selected agency during a specified period of time. So you've got tons of information here to look at very, very granular patient-level data to help understand what's happening amongst your patient population. The risk-adjusted potentially avoidable events 2-bar report provides the mean measure rates for the agency's patients with episodes of care that ended in a specific period and compares it to the national reference. The report includes 12 potentially avoidable events, and a separate graph, a bar graph, is provided for each of those events. The risk-adjusted potentially avoidable event report is also available in a 3-bar version. And this is going to have your current period data, the prior period data, and that national data. Again, I want to point out to you with the dates in this in that upper left, well, it's upper right-hand corner, I guess, right-hand corner, the date ranges are also going to be listed there in the screen for you, or on the report for you. And then there is the all-patient process quality measure report, and this is a two-bar version. So again, you've got your percentage of each process quality measure for episodes of care ending during a specific reporting period, along with the national percentages. And again, there's a 3-bar version of this report that also includes the prior period's data. And again, you've got there your date ranges and the number of cases that appear in that upper right-hand corner. I think this is a neat report. This is your agency patient-related characteristics case mix tally report. This lists each individual case, up to 5,000 cases. It includes patient characteristics in several categories. These categories are similar to those that I shared with you earlier. Patient history, general health status, living arrangements and assistance, and then there's various clinical categories and more that's available. There's Ys and Ns, so yeses and nos in here. A Y indicates that a particular characteristic was present, and an N indicates that the characteristic was not present. If there's a dash, it means that it's not available. The data are not available. So if you have a Y, yes, they had it. An N, no, they definitely didn't. A dash, we don't know. Not enough data to say if they did or not. Numeric results are also going to be available in some of these data cells, and that will be for things like age or pressure ulcer count, so the number of pressure ulcers. And then we have the outcome tally report that details episodes of care ending during that specified report and or specified period, and then these outcomes are used to calculate the outcome risk-adjusted report. So again, individual patient-level data here in this on-demand report. And we have the Home Health Agency Process Measures Tally Report, and this details the episodes of care that ended during a specified period, identifying the process measures that were triggered for that period. So here we're looking at process measures. And here's my favorite report of all. I know my favorite doesn't matter to you a bit, but please check these reports out if you haven't. They're awesome for quality improvement. Really give you incredible insights to kind of look back, especially if you have that awareness of what's been happening in your agency, in your area, with your changes in patients, changes in staffing. This can give you so much insight into what is happening as a result of those changes in your environment. An example of using this report in an SNF from a skilled nursing facility one time, we looked back at this report and looked at changes in, we looked at the trends in falls, and the DON, the Director of Nursing, could easily say, here's when I was reduced my staffing on the weekend, and look what happened to my falls. I mean, it's so easy for you to say month to month to month, what are the changes going on in your agency, and to correlate those back to outcomes. This is incredibly, incredibly rich information that's available to you. And it does provide this information for a 12-month time frame, and it gives you the actual outcome-based quality improvement measure rates versus the risk-adjusted rates, and it also includes the state and national percentile ratings. The percentile ratings aren't shown on the screen. Rather, they're going to be presented on the bottom portion of the report. So what you're seeing here is really the top portion of that report. Please check those out if you haven't yet. They really are very neat reports. The provider preview reports are available on a quarterly basis for all home health agencies. These contain agency-level QM data for all process and outcome measures as well as the claims-based measures, and are automatically generated and saved into your agency's shared folder. They're available about 5 months after the end of each data collection quarter. This allows for the data correction period and time to actually generate the reports. I mentioned that these are generated after the data correction period. As such, the data in these reports can't be corrected once these reports are actually made available. Rather, corrections need to be made prior to the quarterly freeze date, and that happens about 135 days after each quarter. So you've got to use those other reports proactively to go in to say, is our data correct? Are our data correct? And really take a look and explore that proactively. Once you get these provider preview reports, it is too late to go back and fix, okay? These are available to providers 30 days prior to the data being made available to the public. And here's just a screenshot of that report. Notice the agency average as well as the state and national comparisons are there. We also have the quality of patient care star rating provider preview reports. And these are made available to providers or agencies automatically as well. They're saved into the provider's shared folders in the CASPER application. Providers have about 2.5 weeks to review these data and request submission of the rating based on documented errors in the data submitted. So this is something that these are going to be made available to you, and there needs to be a process to act on them relatively quickly, because if there is a problem, you need to get in touch with that pretty quickly. The rating in the report is the rating that's set to appear on the next refresh of the Home Health Compare. And let's look at the report just a bit. You're going to see kind of chunks of the report going from slide to slide here. So in the heading of the report, the date ranges for the claims data and the assessment data are provided along with the star rating. Right below what you see here, you'll find the month and year that the rating will be displayed, and importantly, information about how the ratings are, about the ratings and how they're calculated. And if you continue to go down a bit further, you'll come to info about how to request a review of your star rating if you think there's a problem. So all of that info is right on that provider preview report. The preview report concludes with a rating scorecard that includes your agency's scores on the individual measures and the decile ratings and corresponding score ranges for them. This can be very helpful in assisting you and your colleagues to understand your performance on each of the 9 measures as well as the overall rating. Again, lots of information here to help you understand the ratings. And the report concludes with your quality of patient care star rating. Again, there's some footnotes there at the bottom, and that gives you some dates, some information about when those claims data originate from, and some other information about your rating as well. So footnotes on these preview reports are very important. There's often information that you want to, you kind of think about footnotes as kind of the, oh, it'd be nice to know, not need to know. I would stress that in the preview reports, the footnotes are need to know information. Take a look down there. It's not like when you're just, oh, those are the references in this document. I can look at them if I want to look up something further. Please read the footnotes in these. It's important information. And next we have the quality assessment only, or QAO reports. And these reports alert agencies of their status toward achieving compliance with the OASIS quality data submission requirements. Specifically, these note compliance levels with the requirement that there be matching assessments for the patients admitted to the home health agency. The compliance threshold is 80%, and there are interim reports available on a quarterly basis, as well as an annual report that aligns with the APU determination period. These reports are automatically generated, and they're going to be saved into your agency's shared folder. More information about the reporting requirements, including the types of OASIS assessments that meet the requirements, are on the CMS website on the Home Health Quality Reporting Requirements webpage. So let's take a look at first the interim QAO reports. The reports begin with providing the agency with their score and a notation of whether or not the agency would meet the compliance threshold. Information is then provided about the home health QRP, how the compliance threshold is scored, and a bit of additional information. Then you come to the final page of the report that details the numbers of assessments in the various assessment types. And here it notes the number of these assessments that do or do not meet the quality assessment criteria. The information in the annual QAO report really closely aligns with the interim QAO reports. The report for last year were placed in the CASPER folders at the end of September for the July 1st, 2015 through June 30th, 2016 period, and remained there for 120 days. Watch for annual reports this year at a similar time frame, again after the period closes for 2017. And here's the lower portion of the QAO report. Do keep in mind on the sample report outline as well as on your actual reports that there are notes and explanations for each of these line items. So if you go to that web page that I mentioned to you, and there's links to it available for you, you can click on the sample reports and they'll actually, they're kind of nice teaching tools that you can use, and then you'll get that same information about the data that are included in the reports on your agency's actual reports. And that's what I have for you on reports. That was enough, right? Whew, anybody's head spinning? Lots of stuff. Don't you see possibilities in that, though? As you sit here and listen to it, can you visualize how you in your particular role might be able to use one or more of those reports and how they can really be used to drive quality in your organization? There were some changes to report retention. For Home Health Compare preview reports, the retention period within CASPER changed from 730 to 90 days, and that happened with the reports that were distributed in January for the April 2017 refresh. Excuse me. At that time, all your prior reports were removed from the shared folder. And the folder name is there, again, state code, HHA, and your facility ID is where you'll find these reports. And those distributed in January, again, will be retained for 90 days. Another should have been made available to you in April. And there's also changes to reports that will occur in 2017. Some timelines for some of these things have not yet been finalized. 34 measures will be removed from all of the reports, and you actually have in your folder a really nice document about measures that are staying or going. So do take a look at those. You've got 2 of those documents within your folder. New Impact Act measures will be added to the respective preview and on-demand reports. With the confidential feedback reports, think about that graphic that I showed you way in the beginning of this presentation where the different report types were displayed. And in that box labeled confidential reporting, the QM reports, the review and correct reports, and the provider preview reports were all noted. And these will have the Impact Act measures added sometime this year. The Impact Act does require that providers are able to see their data prior to it being made publicly available, and you have this capability already through your on-demand reports I discussed earlier, including the Tally reports where patient-level information is provided, and the 2- and 3-bar reports where the agency-level data are provided. The Impact Act measures, again, will be included in these within the next year as well. So I have a polling question for you, and that polling question is regarding the retention period within CASPER. It changed from 730 to how many days? 90. You guys didn't even click. You're just shouting it out. You're getting wild. All right. You are correct. It is 90. Well done. And that polling question at the very end of my presentation tells me that y'all stayed with me the entire time. I am grateful. This is heavy-duty stuff, isn't it? But isn't it kind of exciting that you know that the data that you're collecting and entering is actually usable to you at the agency level to drive some change and to monitor quality, and that you're able to really understand and use those data that are publicly available. There's lots of resources here. I'm not going to review all of these things to you, but if I were you and I was going to circle star or highlight one, it might be that QTSO help desk and the QTSO website. Those two things are very, very important resources that are available to you. And at this time, I'm going to invite you to ask any questions, should you have any. And I will be around the afternoon, too, if there's something that you just want to say. What did you say? I have no idea what you were talking about. I'll try to help you figure it out. You guys have been a very gracious audience. I appreciate your attendance and your attention for this session. And is anybody ready for lunch? I'm the only thing standing between you and lunch. Oh, no. Actually, I'm the only thing standing between you and Mark, who's standing between you and lunch. So let me turn it over to Mark. Thank you all so very much.